Coleman provides important assessment services for people to be able to assess their behavioral health needs 24/7 in a variety of different ways, but then provide proper mental health services as follow-ups so they can so people can live in their communities and live in their families and enjoy their life.
We service everybody in the community. I don't know one individual or group of individuals in the county that is not touched by Coleman and what we do. So it's just a reflection of who we are.
We developed the Coleman Foundation to support Coleman Professional Services philanthropically, to provide donations in support of its clinical services. In particular, the campaign identifies key areas of social support needed in order to support these clinical services.
It's growing all the time, and the need is growing faster, unfortunately, than our ability to serve it.
So in this case, our project will go to 2015 and finish up hopefully with 100% of funds gained through donations of approximately $5 million.
Coleman Adult Day Services is a medical model adult day service, which means that everything that we do originates from a plan of care that's developed by the nursing staff.
Coleman Adult Day has a medical model to it, and that means that I know that there are nursing staff here and available. So if anything should go on that perhaps we missed, or if we had just a question, I know that we could talk with them and interact with them, and they'll share information back with us.
We were aware of the service, but not how much it could help our family, and which it has, immensely done. My father and mother both benefit from this service that my dad comes to, the adult day, and that gives her freedom at home.
I think the biggest benefit would be the fact that they are with a peer group, that they can develop friendships and just enjoy the activities and being engaged during the day, and not having any 2 days be the same, and have a little variety. They're not home watching television.
I think it's vitally important that we look at ways to help these folks who have given so much of their life to helping others, to try to find a way to help them live the quality of life that they can in their home, but still have a safe haven to go.
Our actual cost to provide the service is $75 per person per day. The reimbursements that we get do not cover the actual cost that we incur.
It's very affordable, and it's an excellent situation. Yeah, I mean, for what you get, for the food and the consistency and the care, I don't think you could replace that at whatever price.
One example for the needs of the community is focus on children's services in Kent. There seems to be an important focus needed working with school systems and working with child psychiatry, case management, in helping and support children with behavioral health problems. This can range from children suffering with bipolar and ADHD as young as 6 years old, and going through those crucial developmental periods where they can focus on school. We can work with the teachers and the professional teachers and their families in order to be able to be successful in school. That's a real focus in our children right now, is have them be successful for school so they can be educated and they can mature naturally and be successful as they mature in the family.
An important factor for Coleman in seeking the Center of Excellence for Children is to have a facility dedicated to children. Right now we offer wonderful services. They're housed in our Hetrick building in Ravenna and in our Kent building. The waiting rooms are shared in common with adult staff. The office space is also used for adult clients, and it's very hard to make that kind of environment conducive to the treatment of kids when you're serving adults in the exact same locations. We work on a recovery model for all of our clients. That means we're hoping that our clients learn how to do well in their communities with the problems that they present with. In terms of kids, that means educating their parents, educating the children, and helping them find ways to adapt in their community, which is essentially school and family, to achieve their maximum potential. And I think we're pretty successful with that. The Center of Excellence is going to be a wonderful hub for this development because it will be an identifiable place for obtaining children's services. I think it's also going to be a catalyst for the development of evidence-based treatments and research on those treatments and their effectiveness with families in Portage County to take care of our youth before large problems develop. If we don't take those steps in Portage County to replicate evidence-based practices used across the nation, we're certainly going to fall behind and run the risk for our youth increasing in their dysfunction and later problems in life.